Hello, everybody. How is everybody? Although it's a little bit sparse, I'm assuming staff and students will be coming at any time. But we are honored with the presence of the dean and two former deans and many other distinguished faculty members here. Thank you for joining us here today at the Center for Public Health Advocacy's second annual Distinguished Speaker Series event. It took us years to create the Center for Public Health Advocacy. We started with the belief, which we still believe, that it's essential for public health professionals to be as skilled at advocacy as they are in science and research. I am thrilled at the newfound enthusiasm for advocacy and hunger for policy change that I see across our school. This is thanks to Dean McKenzie, who has charted a strategic vision that values advocacy as a pillar to solving public health problems. I'm Oying Rimon. I'm the director of the Center for Public Health Advocacy, as well as concurrent director of the Bill and Melinda Gates Institute here at Hopkins. You may remember that we started our Distinguished Speaker Series last year with Senator Barbara Mikulski. This year, we are honored to host Bill Novelli as our keynote speaker. Thank you, Bill, for coming. Afterwards, after his address, then Emeritus Michael Clogg will join Bill up front for a fireside chat a la Roosevelt. Question and answer, and then we'll open it up to Q&A for all of us. Bill Novelli is a distinguished professor of the practice in the McDonough School of Business at Georgetown University, where he is also the founder of the Global Social Enterprise Initiative. Bill is the co-chair of the Coalition to Transform Advanced Care, a national alliance dedicated to reforming advanced illness and end-of-life care in the US. Previously, he was CEO of AARP, a membership organization of 40 million people 50 and older, and I'm happy to still be a member of AARP, Bill. Prior to AARP, he was the founder and president of the Campaign for Tobacco-Free Kids and the executive vice president of CARE, the International Relief and Development Organization. Bill was also the co-founder and president of Porter Novelli, one of the world's largest public relations firms, which is now part of Omnicom. I think Omnicom is probably the largest ad agency in the world right now. Second largest, yeah. So Bill is on the boards of the American Cancer Society, the Coalition to Transform Advanced Care, the Bipartisan Policy Center Advocacy Network, the Campaign for Tobacco-Free Kids, Capital Caring, Kaboom, and Strategic Partnerships. He also co-chairs the Care, Culture, and Decision-Making Innovation Collaborative of the National Academy of Medicine and served on committees which produce reports on the future of nursing and also dying in America and improving quality and honoring individual preferences near the end of life. Bill has a BA at University of Pennsylvania, an MA from Penn's Annenberg School of Communication, and pursued doctoral studies at New York University. Please join us in welcoming Bill Novelli.
Well, good morning, everybody, and thank you. Oyung, that was a very warm introduction. I appreciate that. And I'd like to thank Dean McKenzie and Dean Emeritus Michael Clogg and the entire center for this invitation. And I want to especially thank Diane Coraggio for her great work coordinating today's events. I'm honored to be the second speaker of this series. And as you just heard, the inaugural speaker was former Senator Barbara Mikulski, somebody that I have always admired. She's been a great champion for the nation's and for Maryland's health and well-being. But Senator Mikulski hasn't always admired me. More on that later. Now in 2014, your School of Public Health held a forum on public health advocacy. And I read that report with great interest, and I used that report in my work. And among other things, the report called for an Institute for Public Health Advocacy in the school. And now you have it. So congratulations on making it happen. You've got a powerful focus on evidence-based advocacy, on influencing social norms, and on improving public health for all. The center's theme is that evidence-informed advocacy is integral to public health practice. And I could not agree more. Advocacy is an essential, inseparable, necessary part of public health practice. We can't improve public health without effective advocacy. And you define advocacy as a combination of individual and social actions designed to gain political commitment, policy support, social acceptance, and systems support for a particular health goal or program. That is an excellent working definition. And I would only add that advocacy is a contact sport. It requires a warrior mentality and plenty of courage. And I may be the only person you know with a collection of hate Christmas cards, which was the result of policy and political battles. And more on that later, too. Now, as you just heard, I'm in the business school at Georgetown, not far from the power structure in Washington, which is also now known as the swamp. John F. Kennedy said that Washington was a curious mixture of Southern efficiency and Northern charm. Now, we've lost a lot of what efficiency we had in his day, and Washington never did have much charm. I've been there a long time. I've been in Washington a long time, and I originally came there from a marketing career in New York. And I came to Washington to help reposition and to market the Peace Corps. And I went on to help set up and work in the November Group, the in-house advertising and promotion agency for the re-election of Richard Nixon. Now, that used to elicit boos whenever I admitted it, but now it's ancient history. And later, as you heard, I co-founded and helped to build a company, Novelli. It's now a global PR agency. And we began that firm to apply marketing and marketing communications to what we thought Washington was all about, health and social issues. Now, you're probably aware that Washington is really about power and politics and money and sex. But we were naive and we didn't know that. And as a result, we did a lot of pioneering work in social marketing. Our first and our most lasting client was the National High Blood Pressure Education Program. And it is still regarded as perhaps the most successful national health promotion effort in American history. We also worked internationally in contraceptive social marketing and reproductive health, and also in infant survival. And my next step was to retire from Novelli. And as you'll see, I've retired many times. And I moved entirely into public service. And that led me to oversee CARE, the International Relief and Development NGO. We worked in some 40 developing countries on agriculture, health, girls' education, micro-lending, and disaster relief. And then with lots of support, we started the campaign for tobacco-free kids to fight the tobacco wars against an industry with huge amounts of money, an addictive product, a near chokehold on the United States Congress and many state legislatures. And later I went to AARP to become the CEO there for almost a decade. Our social impact strategies at AARP were focused on retirement security, health and health care, and independent living. And a lot of my effort was spent fighting policy battles. I called AARP a warrior brand. And I told companies who wanted to partner with us, and there were many of those, that we were on the front lines, engaged in policy and politics. And they needed to be well aware of that if they wanted to do business with AARP. And now, as you know, I'm on the faculty at Georgetown's Business School, where I teach corporate social responsibility and other subjects in the MBA program. I also started and I oversee our school's Global Social Enterprise Initiative. This is a center dedicated to partnerships with corporations, nonprofits, government agencies, and across those sectors to create social and economic and environmental value. We're committed to making sure that every graduating business student, whether he or she goes to Goldman Sachs or to Google or to wherever, understands that there's more than one bottom line. And I've got the scars and the bumps and the bruises to prove all this. And if you work on national and state advocacy and issues long enough, you're going to take a lot of slings and arrows. For example, shortly after beginning the campaign for tobacco-free kids, I got a call from a friend at Burson Marsteller, which was the PR agency that had the Philip Morris account. And he said, "Bill, the tobacco industry is doing a dossier on you." And I was a little nervous, to say the least. And I asked him what kind of information they were gathering on me. He said, "They want to know everything, but especially, are you competent? Can you hurt them?" And then he added, "But you don't have to worry about a thing because I told them you were totally incompetent." Tobacco is a really, really nasty industry, then and now. Now, it took many years, but 5 winning tobacco control strategies evolved. Raise the price of tobacco products. Mandate smoke-free public places. Persuade kids not to experiment and become addicted. Provide help for adults who want to quit, and restrict tobacco advertising and marketing. And 3 of those strategies are firmly rooted in policy advocacy, and the other 2 require advocacy support. Now, when you fight these kinds of battles, you're also bound to encounter the wrath of politicians. Nancy Pelosi got so furious at me that she called me the worst name she could think of. She called me a Republican. And Mitch McConnell, on the other hand, called me a Democrat. Now, I was meeting with him one afternoon in his office when a tornado warning sounded in the Capitol, and a security guard came to escort him to a shelter. He said, "Do you want to come along?" he asked me, "or would you rather risk the tornado than hang out with Republicans?" And I took a look at the darkening sky outside his office, and I gratefully accepted his semi-kind offer. Now, I don't know how many of you remember Jim DeMint. He was in the Senate representing South Carolina, and he went one better. Jim DeMint called me a communist. And I don't remember why, but I think it was about Social Security. I've been assailed by members on the left, John Dingell, Henry Waxman, Ted Kennedy, for example, as well as from the right, Paul Ryan, Tom DeLay, known back then as Tom the Hammer, and Chuck Grassley. Now, John McCain, on the other hand, called me a great American, but he was known to flatter lots of people that way. It was John McCain who was the great American. And then there's Senator Mikulski and the hate Christmas cards. Back in 2004, AAR support was credited with getting the Medicare Modernization Act passed, with prescription drugs in Medicare for the first time ever. And we had worked on this for many, many years. It was a big victory for George W. Bush and the Republicans, and Democrats were furious. They didn't want Bush to have a Medicare victory, and many pundits said that it was too expensive and that it was a flawed bill. And a group of angry AARP members burned their membership cards outside my office in front of TV cameras. And I got a lot of phone calls in the middle of the night, most of which my wife answered. And I got a number of hate Christmas cards, which I still have. "Merry Christmas, Bill, you blankety blank blank. May you go straight to hell." And Senator Mikulski and other Democrats went on a vigorous campaign to attack and denigrate that bill well after it had passed. But that legislation was the right thing to do. 5 years later, a Harvard study in JAMA reported that Medicare Part D was keeping seniors out of hospitals and nursing homes and helping them avoid treatment and enjoy a better quality of life. And it was saving Medicare an estimated $12 billion a year, approximately $1,200 annually, for millions of seniors who had inadequate drug coverage before Part D. And there are two lessons here. Lesson one. First, Senator Mikulski was an ally in many other advocacy initiatives. So there are no enduring adversaries, only enduring interests and principles. Today's opponent may be next week's ally. And to repeat what I said earlier, advocacy is a contact sport. So don't expect to win any popularity contests. As Harry Truman said, if you want a friend, get a dog. Now, have you noticed that America has a lot of problems? Many of them are tied directly to our public health. Climate change is staring us in the face, with lots more trouble ahead due to increasing national disasters, diminished air quality, the spread of disease, and other big challenges. Immigration is a political football, well beyond our leaders' abilities to solve or seemingly even to mitigate. Gun violence is proliferating. I went to a big gun show in Montana last summer. I just wanted to see what the gun culture is all about. And I came away thinking we are a truly divided nation on this issue, which is a public health problem as much as anything else. Our national debt is astronomical. Can we do something? Apparently so. We're making it worse. Our grandchildren are going to pay for that. And socioeconomic inequality is growing. Related to this is our national decline in longevity due to drug overdoses, suicide, and I believe obesity. Dr. Josh Sharfstein, your vice dean, was quoted in the Washington Post recently calling this a very dismal picture of health in the United States. So what to do? What can we do when it's unforgivable to let the other party have a win? Where everything is about maneuvering for the upcoming election, and there's always an upcoming election. Where ideology stands above pragmatism. Where there is little urgency or ability among our policymakers to solve big state and national problems. Now, Jim Hightower, who was once the Ag Commissioner in Texas and is now a political commentator, he famously said that the only thing you'll find in the middle of the road are yellow lines and dead armadillos. That's cute, and it's very quotable, and it's also not true. Most of the voters in this country are in the middle. They're looking for reasonable candidates with sensible programs. I am in the middle of the political road. I see myself as a pragmatist. At AARP, I wanted us to be in what I called the practical center, where problems can be solved in a bipartisan way. See the problem, do the research to understand the problem, and work together to solve the problem. That's where the power of advocacy comes in, and why advocacy is so important in public health as in other aspects of our society. I want to offer 7 lessons learned that I believe public health advocates can use to make a real difference. Lesson 1, be opportunistic. Politics and policy making are messy, uncertain ventures. We need to identify what's possible and focus on what can be done. For instance, the Bipartisan Policy Center has an agenda for 2019 that is far more extensive than Congress could ever take up. It includes Medicaid reform, rural health legislation, behavioral health issues, more opioid legislation, and many other ambitions. And BPC's strategy is to see what's bubbling up in Congress and work those opportunities. Another example of opportunism is the international work of the Campaign for Tobacco-Free Kids, which has been a leader in advancing tobacco control policy change in the US and around the world. They've developed a proven approach to training and empowering indigenous NGOs to achieve tobacco policy change in low and middle income countries. And now the campaign is applying these international policy skills to obesity, cardiovascular health, road safety, drowning prevention, maternal and reproductive health, and preventing epidemics. That's being opportunistic. And most of this work is made possible by the strategic investments of Michael Bloomberg, who saw the opportunity to take what's working and apply it to other risk factors. Lesson number 2, be aggressive, go on offense. My favorite haiku is, problems worthy of attack prove their worth by attacking back. Those are the big, tough problems that we're facing. And sitting back and muddling through are not good strategies. Right now, the FDA is being fairly aggressive about e-cigarettes and flavors and youth vaping. The public health community is supportive. But the public health community is pushing even more aggressively, and they're suing FDA for more and faster action. And they should. Look at Juul e-cigarettes. First, they ran a highly effective marketing campaign aimed at kids, and they captured about 70% of the youth market. And then when the FDA and the advocacy groups came after them, Juul spun out an entirely new story about how their product contains nicotine and kids shouldn't vape. But they just can't help themselves. Now Juul Labs claims they're on a mission to improve the lives of the world's 1 billion adult smokers by eliminating cigarettes. And at the same time, they're negotiating to sell a piece of their company to Altria, the parent of Philip Morris and one of the biggest and baddest cigarette companies in the world. Talk about irresponsibility. But hey, it's just business. Now at AARP, we were very aggressive with our blueprint for action to achieve solvency for Social Security. It was ambitious, and we promoted it and tested it in town hall meetings all across the country. We were on offense. And in working with the Robert Wood Johnson Foundation on setting up the campaign for tobacco-free kids, I said, don't give us this money if you don't want us to be aggressive, because we are going to attack the tobacco industry. Lesson 3, be political, but not partisan. As I said earlier, today's foe could be tomorrow's ally. AARP fought the Business Roundtable because they supported partly privatizing Social Security. But when we approached the Business Roundtable to work together on healthcare reform, they said, why not? You kicked our butts on Social Security and showed what you can do, so let's work together. I had a plaque in my AARP office, and I saw it every morning when I came into work. It had 2 quotes. The first was from Trent Lott, the conservative senator from Mississippi. Lott said, AARP is a wholly owned subsidiary of the Democratic Party. And the second quote was by Congressman Pete Stark, a liberal Democrat from California. Stark said, what does AARP stand for? Always advocating for the Republican Party. And there you have it, right down the middle. Work with both sides to your own advocacy advantage. Lesson 4, be accountable. As you say here in your center, advocacy has to be evidence-based. You can't make it up, or you'll lose credibility, and you won't know what works. But when it comes to monitoring and evaluation, it's difficult to measure progress. And yet it's important that we assess the value of our investments in advocacy. Yes, we can count things like hearings and roundtables, briefings, town halls, co-sponsors. But let's not fall into the trap of only measuring what's easy to count. Advocacy is largely an art, and it's important to apply judgment to our assessments. It's more like anthropology and ethnography than it is like math. And because policy advocacy is often a long game, it's necessary to look at strategic capacity building and whether we're building a foundation for eventual success. After we lost national tobacco control legislation that was brokered by state attorneys general, it took another 11 years to get FDA oversight over tobacco. We usually cannot expect quick wins, so often it's necessary to account for interim outcomes and progress. Lesson 5, have a framework and a plan. One of the foremost health policy advocates in America is sitting right here with us today. Vinnie DeMarco has done remarkable work in the state of Maryland on healthcare reform, tobacco control, gun safety, and other issues. Vinnie is a man with a plan. He centers his campaigns around public interest polling, building strange bedfellow coalitions, successful media relations, candidate and election strategies, and then legislative success. Now, granted, not every issue has the same elements, of course, but we need a framework that's based on learning from previous experience in order to succeed. As I said, I have a commercial and social marketing background, and it took me a while to move from focusing almost entirely on individual behavior change to realize and incorporate into my framework the power of policy advocacy and its broader impact on social norms and expectations. Lesson 6, engage the public and gain their support. Policymakers care about public opinion, and I guarantee you they care about votes. So back in the day, I used to be able to go into a politician's office at the state or the national level and say, more than 50% of all the voters in the recent midterm election were over the age of 50. And half of them, fully 25% of all voters, are AARP members. That got some attention. Of course, not many organizations can say that, so it's doubly important to understand and appeal to public audience segments. But as we know, public opinion can be a mysterious thing. People say they want less government and fewer taxes, but more government services. They say they want less money spent on health research, but more medical cures. The public wants more patient care, but often with little attention to their own health status or their own medical conditions. A lot of opinion research is not insightful enough, and that's where your center's attention to conducting effective, formative research to inform advocacy communication can make an important contribution. Consider the work of the American Cancer Society, on whose board I'm pleased to serve. A key ACS goal is to get 80% of boys and girls vaccinated for HPV by 2026, and then to take that program worldwide. Getting parents to understand the importance and to deal with the social and sexual concerns involved in HPV vaccinations takes careful, insightful research. Communicating through storytelling is a hot topic these days. Everybody is telling stories to illustrate key points, from TED Talks to corporate trade shows. And many of these stories are fascinating and entertaining, but they aren't strategic. As public health advocates, we can do better. The Coalition to Transform Advanced Care, or CTAC, as you heard earlier, is a national alliance dedicated to closing the gap between what Americans, often the frail elderly, want when they are seriously ill and what society and our medical system offers them. And much of this is policy related. Now, there's an old gerontologist story that goes like this. We should all live to a ripe old age, well into our 90s, and then have it end with a quick bullet, fired by a jealous lover. Now, that's a nice thought, but it's not how most of us are going to go into the great beyond. And so we have to look at the reality. And one big challenge in advanced illness care is empowering patients and their caregivers to be more involved with clinicians in treatment decisions. At our recent CTAC National Summit, we put a blue chair on stage, and we had a breast cancer patient enact an actual experience she had gone through not long before. As her story goes, a young physician came to her in the examining room, and he quickly listed the procedures she was to undergo. The patient suddenly rebelled. She saw a chair, which happened to be blue, across the room. And she said, "Doctor, do you see that chair? Sit in it." And he did. And she proceeded to tell him about herself, her family, her fears, her hopes, her values, and about other physicians who had spoken to her as he did. And then she had a real conversation with that physician, sitting in that blue chair, who now understood his patient. It was a powerful reenactment on stage, and it was captivating for our summit attendees. We now plan to brand that blue chair and make that story a foundation for promoting patient, caregiver, clinician communication and decision-making. Great stories on strategy and about real people, authentic and well told, are powerful. Lesson 7, leadership really, really matters. It's been said that leadership is the cause and all else is effect, and that's close to the truth. One of the most important lessons about leadership, certainly in public health advocacy, is that you don't have to be the man or the woman in charge to be the leader. We can lead from the front, the middle, or the back of the ranks. My colleague at Georgetown, Leslie Crutchfield, has a new book out. It's called How Change Happens: Why Some Social Movements Succeed While Others Don't. She found that effective movements are what she called leaderful, not leaderless or leader-led. We can all be engaged, we can all lead, and we can all make a difference. Now, with the country in this ragged state that it's in, and with good policy, with policy advocacy being so essential in our form of democratic government, and with these lessons learned, where can we go from here? I'd like to conclude with a suggested way forward. One of my all-time favorite politicians is Olympia Snowe, the former U.S. Senator from Maine. She was known for moderation, for crossing the aisle, for staying calm in the face of political rancor. One day during her Senate career, she said to me, "I really don't care how much Chuck Grassley yells at me." And by the way, Chuck Grassley is still yelling, most recently about the Brett Kavanaugh confirmation hearing. But unlike Susan Collins, Snowe's fellow moderate Republican senator from Maine, Olympia reached the end of her rope. She decided not to run for re-election. In her book, Fighting for Common Ground, she said that the Senate was no longer a legislative body where the key issues facing the country could be resolved. She said that Congress has become a place of burned bridges and scorched earth. And today I see Olympia at the Bipartisan Policy Center, where she's a senior fellow and where she promotes civility as the way to bring our warring parties together. Besides civility, there are lots of other helpful ideas about reducing the toxic partisanship that plagues Washington and many state capitals. Some call for rebuilding the trust and community within our legislative bodies. Still others are about term limits, or getting a younger generation into office, and getting big money out of politics. And what if the Supreme Court ruled that partisan gerrymandering is just as illegal as racial gerrymandering? All these proposals have merit, but I have another idea. I think it's time to get angry and much more aggressive. Let's really go on offense. I think the public health community has the standing and the courage to lead the way. I'm not talking about crazy, nasty mad, which we see so often today. I'm not talking about torches and pitchforks. I'm talking about being relentless, strategic, and aggressive. Let me give you 2 examples. 60 years ago, a retired school teacher, the first female principal in the state of California, Ethel Percy Andrus, got angry. Now, back then, educators had meager pensions and no health insurance. And as the story goes, Ethel set out to visit a retired teacher she knew. And she found the woman destitute, living in a chicken coop. Ethel got mad, and she got organized. She began a crusade to provide affordable medical insurance for retired educators. It took tremendous perseverance. But 8 years later, she was able to offer the first ever group health insurance coverage to retired teachers throughout the country. She started the National Retired Teachers Association, and then she founded AARP. Ethel saw AARP as what she called an army of useful citizens who had the ability, the experience, and the desire to promote and enhance the public good. She worked the White House, Capitol Hill, and many state houses to advocate for older Americans. She gave the organization the motto that still guides AARP today: to serve, not to be served. That motto, to serve, not to be served, is the exact opposite of the attitude that now exists in American politics. Here's a second example of aggressive perseverance and getting organized to make things happen. When the history of tobacco control is written, the Robert Wood Johnson Foundation will have a prominent place in the story. And it's because of Dr. Steve Schroeder, their former president. Back in the mid-90s, with smoking among adults and children at alarmingly high levels, Steve strongly recommended to the foundation board, many of them corporate executives, that they invest heavily in tobacco control. The meeting was contentious, and the board was divided. At a key point, the board chair slipped Steve a note. It said, "They're not going to approve this, and so you should drop it." Steve tore up the note, and he kept arguing his cause, and he finally carried the day. And the result was a multi-million-dollar commitment and great leadership for national and state advocacy initiatives. That was a powerful turning point in American public health. History is full of other examples of being aggressive and getting organized to make a difference. That's an American legacy. Public health missions are inspiring and they're powerful. We're all mission-driven people, and we all believe in making the world a better place. Now, a few years ago, there was a newspaper article about how a newly discovered bacterium was eating much of the oil spill in the Gulf of Mexico and could potentially take care of this enormous problem. Wow. Wouldn't it be great to have a similar bug to attack other big problems like obesity, gun violence, or social determinants of health? But no such luck. That story was inaccurate. There's no virtuous bacterium to eat any of these huge problems we face. So we have to do it ourselves. We have to do it ourselves. And we can. We don't need to wait for the worm to turn in American corrosive politics. Let's make change happen by using our advocacy skills and going on offense and getting organized all across the country. The late Congresswoman Barbara Jordan said that what people want is an America as good as its promise. That's what we should work for, and that's what we can do. Thanks very much.
That was great. So imagine a fireplace here.
Okay.
And,
Is it right in the middle there?
Yeah. And it's not too warm, it's just right. And we can have our fireside chat. So, wow, that was a great talk. I mean, there were so many words of wisdom in there and so many questions I'd like to ask you now. But I'm going to reassure Diane that I'm going to go by the script, okay? But lots of opportunities for thought. And I have to say, we've met briefly before, but I'm amazed, given all that you've done, how young you are.
Oh, yeah.
It seems like you've had enough accomplishments for many lifetimes. So.
I haven't gotten old enough to join AARP yet.
Right. Well, AARP, for those of you who turn 50, you know what an organization is, because the day you turn 50, you get the invite in the mail. It's just, what an information system.
True enough.
Yeah, and so, so let me ask you, what led you to take this road down public health advocacy? You know, what life experience or what event pushed you in this direction?
Well, maybe two things. One was, as I said earlier, I was a marketing guy, and I was applying marketing to social change. But marketing people think about a marketing mix, and they think about changing your behavior or changing Vinny's behavior, that sort of thing.
Right.
And it took me a long time to figure out what many of these folks are learning here, which is that's not enough. You have to operate at two levels. You have to operate at an environmental level and change social norms and expectations, as well as at the individual behavior change level. And one day I just had an epiphany and I said, you know, that's what you have to do. And the most powerful strategy for changing environmental norms is policy.
Yeah.
And then the second thing is...
but why didn't you sell toilet paper?
Why didn't I?
Yeah, I mean, you could have used that inference to, you know, to create a new toothpaste or toilet paper. Right?
Yeah.
Toilet paper could be a public health.
Yeah.
You know.
Well, I was making money selling cat food and dog food and kids cereals and so forth. And one day, a guy came into my office, and I had just come back from the client, and I was working on two new products: a kid's cereal and a soft, moist, extruded dog food. And this young copywriter came in and he said, let me see some products for that kid's cereal, because we're writing concept statements. So as a joke, I threw him a bag of the soft, moist, extruded dog food, and he caught it and he said, yeah, we can sell that. And I said, that's it, I'm getting out of the business.
Yeah, okay. Well, that's a good response. So let me ask you about, you mentioned Medicare Part D and the tremendous benefit. And I can remember that war and the donut hole. And so those of you remember that there was a gap in benefits for that, and it was attacked. But what is it that, you talked a little bit about this, but let me ask you, what is it that made that effort successful?
Good question. A couple of things. Number one, from a broad perspective, the Republicans thought that if they could pass this, they were going to basically capture the older voter for the next decade. That's what they had in mind. So I said to myself, how can we take advantage of that?
Right.
The second thing was I had a great team. And I am a big proponent of teamwork. I think that's how you get things done. The third thing is it took either stupidity or guts. I'm not sure which it was. But we had plenty of fights every night up on Capitol Hill. I mentioned Tom the Hammer DeLay.
Yep.
And he said to me one night, you know, if we take on board the things that you want to change, you'll just cut and run. And I said to the Hammer, no, we won't cut and run. You can count on us. We're on board.
Right.
Then I had to go back and sell it to my board.
Right.
And that was equally difficult.
Yeah, I can imagine, especially the provision that we couldn't negotiate for drugs. You know, it was, I guess, was that a...
That was a mistake.
Yeah, but was that a sort of a bone that they threw to
No, it was
business,
crazy.
or?
It was crazy.
So you know we're talking about, you're not allowed for Medicare to negotiate with drugs.
Yeah.
The VA can negotiate, I think.
Yeah, it was crazy. The Congressional Budget, Vinny knows this, the Congressional Budget Office said that would not make a difference. So we didn't push for it.
Yeah. Well, that was wrong, yeah.
Right.
that was wrong.
Blame it on them.
Yeah. So, well, those times now seem, like you talk about Nixon, and my father-in-law was a big fan of Nixon's, and this was a topic of conversation in our household for many years, still is. But Nixon does look much better. He looks like a liberal now, right? What do we do in times like this where things seem and are, I think, worse than they've ever been in terms of people denying science, denying evidence, unclear sometimes what the motivation is, other than personal gain.
Yeah.
So how do you take these tools you've been talking about and the things you've done and apply it to a situation?
Well, you know, that's a heck of a good question. I suffer from incurable optimism. And I think we have a fantastically resilient country. And I think we're going to get past all this. And I think we're going to be stronger for it. And it's frustrating. It's frustrating for people here who study science, who are scientists. I mean, the world is not flat.
Right.
And I think that one of the key things we have to get better at is really, as I said earlier, influencing public opinion. Yeah, there are people in Wyoming who want coal jobs.
Right.
I come from Pennsylvania. People there who still think about coal jobs.
Right. Yeah.
But I think public opinion is going to be an important part of this. And I think eventually we're going to win.
Yeah. Well, I hope you're right. What is it, though, that about... so I grew up in Pennsylvania.
Pittsburgh.
I grew up in the anthracite region.
By Terminus.
Yeah. And anthracite's much better coal, by the way. But what is it about people who will maybe want coal jobs, who will buy onto a whole nother agenda because of that? Do you think influencing their belief system through the kinds of interventions you talked about, polling and then understanding and campaigns?
Yeah, no, we're never gonna sell everybody. I mean, that gun show in Montana taught me a really good lesson. I mean, those people worship what they perceive as the Second Amendment.
Right.
So we're not going to go in there to Missoula, Montana, and tell those 500 people that they're wrong. That gun violence is a really serious problem in our country.
Right.
But I think we can find middle ground.
Yeah.
I think we have to keep at it.
Yeah. Well, so I was on a plane recently with a man from Texas, and we had a long talk, and we talked about guns especially. And, they believe it's a violent. I mean, they believe these shootings at schools are horrendous, and that, no child should die. I think where the difference is the solution. They believe the solution is that we all have guns, and then we could kill the shooter. And we just saw in that terrible mall shooting that that's not always the case. So, yeah. So I think you're right. Understanding what people believe and where there's common ground.
Yeah, and finding that common ground.
Yep. So you talked a lot about relationships, and it's clear just from this short interaction, you're a very affable guy, and you're humorous, and you're good. Tell us how you maintained these relationships over the years for advocacy, where you talk about you have a relationship with Tom DeLay, who at least his persona was not a nice guy. He really was a hammer, right? Trent Lott, not like a nice guy. But do you continue to maintain relationships across the aisle through? How do you use these relationships for advocacy?
Yeah, it's a terrific question. There's an adage in advocacy, which is you don't just go see a policymaker when you want something.
Right.
I mean, you've got to maintain relationships over long periods of time. DeLay, DeLay was a very transactional guy. After that Part D program passed, I went in to see him about Social Security. And I said, here's where we are, and we're not going to support the president on this privatization. And he said, then we'll fight. And I said, okay. And we won that fight too. But I've made mistakes in relationships. I want to tell one quick story. I was thinking about this and about what your question was. So I really made Nancy Pelosi mad. And she's got for those of you who have ever met with her, she's got a very long memory.
Yep. She's from Baltimore,
She's from Baltimore.
Her father was mayor here.
She comes from a long political family. So I made her mad. She wouldn't talk to me. She was angry for, 3-4 years. And then I got an invitation to receive an award. It was the Italian American something Foundation. And I am not big on ethnic stuff or ethnic awards. And I said, no, I'm not going to do that. And then I saw that she was also receiving an award. So I thought, aha, this is a chance to try to get back into her good graces. So we had a picture taken, Martin Scorsese and me and Nancy Pelosi and Rudy Giuliani.
Oh yeah, he's another winner.
And so she wouldn't say a word to me. She stayed on the other side of the picture. And then each of us got to speak whenever we got this award. And I spoke about the country and about good works and about public health and about doing the right thing. And I did a pretty good job, I thought. And I was walking back to my seat, and she leaned over to me and she said, that was really good. And I thought, I think I mended a bridge.
And did you?
I did.
You did? Oh, good. Well,
I mended a fence, I should say.
Yeah. So you've given us lots of, I know I have another 10 minutes, but another 4 minutes. I have another 4 minutes. But I think we are going to open it up to questions, right? So maybe what we should do, if I were you in the audience, I would really want to be able to ask Bill questions and talk to him. I'd just say, we could talk some more, but let's open it up to questions. And Ying, do you want to moderate the questions? Or, Dan? Oh, okay. So. Oh, yeah, I don't need it anymore.
Do we have any questions from the audience? Yes.
So, Bill, you've taken on a lot of big issues, and you were in a terrific position to look back at all these successes, and presumably there were some that weren't successes. But I think what you've given us the feeling for, this is, if you pick an issue, it's a long haul. And so what advice would you have to young people, which excludes me, of course, young people who want to be advocates, but thinking, I mean, even if I don't get it done, I might work on this for 30 years and not have anything to show for it at the end. You know, how should I be thinking about that?
Well, you know, I teach young people, mostly MBAs, but I interact with all kinds of students, from the policy school, from the School of Nursing and Health Studies, all over Georgetown University. And I think that what we're talking about here today is a noble pursuit. I don't think there's any better career than public health. And I don't think there's any better part of public health than fighting the fights that we're talking about. And if you have any sense of, you know, wanting to make the world a better place, you should seriously consider what we're talking about today. I go home every night with a song in my heart because I see the kind of people in this room, the kind of people at Georgetown, tomorrow's leaders, and I say, they're going to get more done than we ever did.
Well, I couldn't agree more. That's great.
Anyone else? Oh. I'm going to, Halida?
That was very good to see that advocacy, you know, how, and you talked about aggressive, be strategic. Can you explain a little bit more, like how aggressive, how far can you be aggressive, and then where you restrain yourself, not being, you know, very...
Well, I think that I sometimes err on the side of being too aggressive. But I don't think that you should err in the other direction. There are too many people just sitting around waiting for the world to change. When I was at the Campaign for Tobacco-Free Kids, we had a lawyer, an outside counsel. And I used to say to this guy, I want you to help me put my toes on the line, okay? I don't want to go over the line and become illegal. I don't want to go to jail. I want to be as close to that line as I can in terms of being a C4, being a C3, doing the things we have to do to advocate and to be aggressive. And he used to say, you got it. That's what I mean about being aggressive. I don't mean being crazy or unwarranted, but I think that we have to be on offense.
Thanks for that. All the advice you gave us, I think that's really helpful. Do you have any tips for how researchers can translate evidence so policymakers know what solutions are best and how to make change?
Yeah, first of all, we need research. We need an evidence base. We can't go anywhere without it. Otherwise, you're a flat earther. We need what you're doing and what other people in this room are doing. Number two, there's nothing worse than a 42-page paper that a policymaker is not going to read. And so she says to her staffer, here, you read this and tell me what it says, and the staffer doesn't read the paper. We have to translate the kind of research that you're talking about into action, into things that people can understand. And earlier I was talking about storytelling. If we can combine facts with stories, I think we can be effective.
Hello? Oh, thank you so much for your talk. One of the things that I loved you saying was that the most effective movements are leaderful. And I think one of the things that I have seen and struggled with myself is being a leader that empowers those leaderful movements rather than having people essentially act as bystanders and saying, oh, that's so beautiful, good job, you know, keep moving. So how do you inspire people to also feel as empowered to take on the pieces of the policy, the movement, whatever it is that you're trying to advocate for.
How do you inspire people to lead, to be a leader?
In whatever level they are present in.
Yeah. You know, this is going to sound a little bit like bragging, but I think that the most important thing we can do is to believe in the people we're working with. Yesterday I had lunch with a woman, I won't tell you who it is, and back in my Porter Novelli days, we won the Kellogg business, the company, PR business. And the Kellogg, the senior vice president from Kellogg said to me, you won the business, you come out here next Tuesday, we're going to have an orientation, but I don't want you to bring that young woman with you. I don't want her on my business. This was somebody we'd had in the presentation. And I wasn't going to stand for it. I mean, this was a big piece of business. I didn't want to lose it, but I said, no, I'm not going to do that. I want you to give her a chance. And she knew this. I told her about it, and I told her that I was going to support her all the way, but that she had to do a great job.
Is this Kellogg Foundation? Or
No, the company, the Pop-Tart company. So yesterday I had lunch with her. I hadn't seen her for, I don't know, many, many years. And we reminisced over this story, and she became a real leader. And as I was walking out of the restaurant, I was 20 feet away from her, and she said, I cried. I said, what? She said, when you left Porter Novelli, I went into my office and cried. And I thought, you know, again, I don't want this to sound like bragging, but I thought to myself, I made a real impact on her when she was at an age when leadership and understanding and support was important. And now look what she's accomplished. So I think you got to believe in people.
Hi, thanks for your talk today. The question over there and some of your comments have made me think about, you've had so many great public health leadership experiences, but I'm interested in your organizational leadership experience and kind of building on that last question. What lessons have you learned or have you found were successful for promoting diversity in the organizations that you've led and for building up the women and people of color who've worked with you?
I think that when I was at AARP, I used to say our membership and our board and our team are going to reflect the face of America. And I think that's the right thing for us to do. But where I always come down is there's a business case for this. And let's get everybody to understand the business case. Yes, it is the right thing to do, but if you have a diverse team, you're going to get better ideas out of that team, and there's proof of this, than you're going to get if you have a monolithic team. Secondly, if you have a diverse team, they're going to better reflect the target audiences that you have to be able to communicate with. And that's really, really important. And so when I talk to people, I say, we need a business case for this diversity that we're trying to work on. So at my Global Social Enterprise Initiative, we're working on getting companies to hire persons with disabilities. And we're working right now on a terrific business case for that. And yeah, they ought to hire people with disabilities because it's the right thing to do, but they can make money. They can reduce staff turnover. They can increase employee loyalty by doing that. So yeah, it's the right thing to do, but let's develop the business case as well.
I think we have time for one more question. Are there any others? Yes.
Building on some of the thoughts and comments from other attendees, I just want to ask, in an environment where facts and evidence often is not the motivation for decision making, what is the strategy that you often turn to? Do you keep working on your messaging to frame it in a different way that's more compelling to the person, or do you seek other allies where you keep communicating to one policymaker and you're not getting through to them through different types of messages? Do you just go around the table and look for other allies and champions?
Well, I don't want this to sound flippant, but the answer is yes. You do all those things. And one of the things I talked about very briefly is, and Vinny will talk about this, I'm sure, on Friday when he speaks, the idea of strange bedfellows. So if you can put together a coalition of organizations that are unlike you. Somewhere in there is almost surely going to be the ability to appeal to a policymaker that you don't have, that somebody else has. It could be a business group, it could be a religious group. Like in the campaign for tobacco-free kids, I spent a lot of time trying to get evangelicals to buy in on the idea of tobacco control. They were very different from the campaign for tobacco-free kids, but they could appeal to policymakers that I never could. So I believe we do what you said, but I think strange bedfellows make a big difference.
So many of you are probably not familiar with this. I joined Hopkins in 1984, and when I joined Hopkins, there was no Center for Communication Programs yet at the time, and there was a project in which it used a systematic approach to behavior change. And the process that was developed was called the P process. With various changes, it is still the key method that's being used at the center, and the director of the center is here. So when I was talking to Phyllis Putro and Bill Smith at AED, I said, who developed this? And I said, to tell you the truth, it was Bill Novelli. You remember that, Bill?
Yes, I do.
It still endures, you know.
Yeah,
and sometime a few years after that, we found this young guy who was a former vice president of Porter Novelli. And I said, young guy, former vice president of Porter Novelli, got involved in the HEART campaign. So we recruited him. And his name is Gary Saffitz. And he has been with CCP and Hopkins for a long time. Until now, he's still a consultant to the Challenge Initiative.
You know, I just talked to Gary Saffitz last week.
Oh, you did?
And it's a point, if I may say this. You know, when somebody left Porter Novelli in my early days, I used to get so upset. I would go into a funk. I would say, why are they leaving? And as I grew older, I began to see, not just there, but AARP and the Campaign for Tobacco-Free Kids, I began to see that people go on to other things. And that what happens is you develop a network, and those networks interlock. And over time, you have a fabulous alumni association. And that's part of the joy of life.
So I've never worked with you, but consider me as one of the people you influenced.
Thank you. Thank you very much.
Well, thank you very much, Bill. Yeah.